Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about preparing yourself for the CCS exam. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Alright guys, so here's the thing. I have been getting lots of questions. Blue, what books should I use to prepare for the CCS exam? Blue, I'm interested in taking this program from this school for the CCS prep. What do you think of this? Or do you think I should purchase these online exams to prepare me for the CCS exam? Here's the thing, guys. When it comes to the CCS exam, this is the gold standard of medical coding credentials. I don't care what anybody tells you. It is. Because this says that you have mastered both inpatient and outpatient. Now, I got this credential last year, but I have been a medical coder at the time. I was a medical coder for 13 years. I am currently a medical coder of 14 years. But it took all this time because with the CCS, this covers inpatient and outpatient coding. Now, I had taken the CCA exam back in 2008, so we were still in ICD-9 times. So the test was a lot different back then. And when you switch over, like we did, into ICD-10, this completely changed everything. And so I had taken the CCSP earlier in the year, and then I had decided, okay, I'm going to go for the CCS because, again, that is the gold standard of medical coding credentials. And it says you have mastered. And that's where I am, right? I'm at the mastery level. So when it comes to medical coding, a lot of people are trying to get through these programs, and sometimes they go through really good schools, and sometimes they go through really fast schools that say that they'll prepare them for the CCA or the CCS. And they really try to push people to take the CCS. And the people not knowing, right, that it's what the level of complexity this test is. Now, this test is very difficult to explain to somebody who has no background in medical coding at all. Is it possible for people who don't have background in medical to pass this? Yes, it is. But it takes a lot of studying. It takes a lot of reading. It takes a lot of preparing yourself. Well, Blue, how do I prepare myself? When I talk about preparing for the CCS, I tell you guys all the time to make sure that you understand your medical terminology, your anatomy, your pathophysiology. Pretty well straightforward, right? But this part gets a lot of people. And they say, well, I'm not really strong with medical terminology, but I'm okay with anatomy. You have to be strong everywhere. Because if you're not, then you're just not ready. And you have to know your ICD-10-CM, your ICD-10-PCS, and your CPT manual. You've got to know that forward and backward. There is no option of, well, I'm not really strong in diagnosis coding, or I'm not really strong in CPT coding, but I'm okay with PCS coding. There is no such thing because, again, you're not ready. Now, when it comes to this exam, there is no telling what is on this exam because every exam is different. No two exams are the same. And so because of this, there's really no way to prepare. It is about understanding the whole concepts of this field. And I'm going to read to you guys the, the concentration of the exam. But I'm going to read this also from the first part on the AHIMA website, where it talks about preparing for the exams. So it says, preparing for the exam. No two candidates have the same knowledge base and experience and educational backgrounds vary. Many candidates spend time studying and preparing for the exams to determine how well they might apply their knowledge and experiences. Therefore, it is not possible to train or teach to the exam by reading certain books or memorizing specific information. The best way to prepare is to review and study the exam content outline for the selected exam type. So for the CCS, the Certified Coding Specialist, it covers 4 domains, right? Coding knowledge and skills is 51% of this exam. Coding documentation, provider queries, and regulatory compliance. So for coding knowledge and skills is 51.9%. The tasks to be able to say that you've mastered this part, right? The tasks are apply diagnosis and procedure codes based on provider's documentation in the health record. Determine principal/primary diagnosis and procedure. Apply coding conventions, guidelines, and regulatory guidance. Apply CPT and HCPCS modifiers to outpatient procedures. Sequence diagnoses and procedures. Apply present on admission guidelines. Address coding edits. Assign reimbursement classifications. Abstract pertinent data from the medical record or from the health record. And recognize major condition and comorbidities, MCCs, and condition and comorbidity, CCs. So under coding documentation, which is 10.1%, review health record to assign diagnosis and procedure codes for an encounter. Review and address health record discrepancies. And then provider queries, 8.9%. Tasks, determine if a provider query is compliant, and analyze current documentation to identify query opportunities. And regulatory and compliance, right? Regulatory compliance, 29.1%. Ensure integrity of health records, apply payer-specific guidelines, recognize patient safety indicators and hospital-acquired conditions based on documentation, ensure compliance with HIPAA guidelines, ensure adherence to AHIMA's standards of ethical coding, and apply the Uniform Hospital Discharge Dataset, the UHDDS. So these are all the things that this exam says that it's going to touch on. Now, if you say, well, what book, what should I do, what should I do? Guys, this is the thing. When you're going through your program, and hopefully they've gone over medical law and ethics and they've done all of these things, they've also hopefully encouraged you to research and look at the CMS website, cms.gov. Now, there's a lot of really important things on there when it comes to regulatory, right? Regulatory guidance. And it talks about that right there too. It talks about recognized patient safety indicators and hospital-acquired conditions. You know, when you look on CMS, you know, there's a lot of really good guidance in there. And there's also the Medicare Learning Network that will talk to you about or give those guidebooks, those booklets on like the global periods and things like that. So there's a lot of really helpful information there. Again, that is all free and you don't have to pay for that. When you are looking at your books, right? And hopefully you are looking at all of your books because you need to be strong in all of your books. If you are not strong in CPT, that needs to be your focus. If you are not strong in ICD-10 PCS, that needs to be your focus. If you are not strong in ICD-10 CM, your diagnosis coding, that is where you need to focus. Now, I do recommend Optum 360. They do not pay me to talk glowingly about them, but I love them. So I used the ICD-10 PCS book from them because I trust Optum. Now, in the back of this book, there is a quiz in Appendix M. And in Appendix N, like in Nancy, they have all of the answers to that quiz. There are hundreds of procedures to look up. This was part of my regimen when I was studying for the CCS, was going through and looking up those codes for that on that quiz, so that way I could get so familiar with this book. The thing about getting familiar with these books is it's only going to help you if you are spending the time getting to know these books. If you are spending time, or wasting time rather, tabbing and writing and highlighting and doing all that, I say it's wasting time because you're not really absorbing the information when you're just highlighting and tabbing and writing. Now that may be the way that you learn, but these are not workbooks, guys. These are reference books, and they're written by doctors and scholars, very intelligent people. You just have to learn how to use them. And you have to spend the time to get to know them. Because if you are not spending time with these books, if you are not spending the time running through the exercises and doing the drills and getting faster and knowing what the ranges are, it's only going to hurt you. This exam is between 100 and it is a 4-hour exam, just so everybody knows. It is a 4-hour exam and it's between 115 and 140 questions. So roughly it's about 2 minutes per question. Now you cannot flag, you cannot go back on these questions. You have to answer the question and move on. So if you were thinking that maybe you could, skip all the hard ones and then come back to that and just get all the easy ones done, no. You have to answer every single question before you can move on. Now, this is a 2-part exam. There is a multiple choice section, and then there's your case studies section. So let me see if I can get to that part right here. All right. Exam specifications. The CCS is a timed exam. Candidates have 4 hours to complete the exam. The total number of questions on the exam range between 115 and 140 question total items, right? The exam consists of 2 sections, a multiple choice section and a medical scenario section that's covering inpatient, outpatient, and emergency department. The exam is given in computer-based format. AHIMA exams contain a variety of questions or item types that require you to use your knowledge, skills, and or experience to select the best answer. Each exam includes scored questions and pretest questions randomly distributed throughout the exam. Pretest questions are not counted in the final results. The passing score for the CCS is a 300. Competencies for the CCS fall into 4 domains. Each domain has a specific percentage of the total questions on the exam. You can see the outline below for greater detail, which is what I just read to you guys. So it says right here, mandatory books. The 2021 code books will be used before April 30th, 2022. All exams delivered on or before April 30th, 2022 will be required to have the 2021 code books from the 2021 code book list below. And then the 2022 code books will go into effect on May 1st, 2022. All exams on or after May 1st, 2022 will be required to have the 2022 code book and the 2022 code book list below from there. And then on test day, all candidates must bring the correct books to the test center. Candidates who do not have the correct code books will not be allowed to test and will forfeit their exam fees. So then it goes into like the all the approved books. But Optum 360 is on the approved books list, right? So again, I used this to prepare. And I flipped through here and I was going through because I don't have experience on the inpatient side. So I knew I really had to buckle down and make sure that I studied on the inpatient side. So I do recommend this book, and I do recommend going through and doing the exercises in Appendix M and then checking your answers in Appendix N. So I did that. I also recommend studying from the CPC study guide. Yes, the CPC study guide for the the CCS, sorry. So with this book, the CPC covers the outpatient setting. Yes, you can use this to study with. You are just studying with it. A lot of people ask me, what book do I recommend? Do I recommend they got the CCS exam prep book? I do not recommend this book. I do not recommend this book. I do not like the layout of this book. I do not like this book because so many people write to me and tell me, Blue, none of those questions were on the exam because they're not supposed to be on the exam. Everybody would be able to pass if these questions were on that exam. I've seen people get cocky, taking this, oh yeah, I passed it, I'll be able to pass it. One gentleman was so cocky, he said, oh yeah, I did really good on it, I'm not worried about it, and he failed. So take it seriously, guys. Take it seriously. Just doing well on that book, it means nothing. It literally means nothing. And with this, the CPC study guide, I like the CPC study guide because there's a couple of questions in here. I didn't really like the answers they had, but that's okay. But with this, it breaks things down. It does give you the rationale as to why they got that answer and things like that. So this is a great book to study with, okay? When it comes to the CPT side. And this is when you're looking at the CPT stuff and you're trying to make sure that you're going in the right direction. This will give you good practice. And this is a 2019 book. And yes, this is what I used when I took the exam last year to prep myself. because I didn't really have to do it a whole lot because I'm already on the outpatient side anyway. But anything that I did do, it was with this book. So you can get a 2020 if you like, but they have the same questions as a 2019, and 2019 is cheaper. So again, you don't have to spend a lot of money, guys. I see a lot of people so willing to spend tons of money just trying to figure out which exam thing to get in this prep book and that prep book, when all it is just getting a prep book like this and getting the Optum 360 coding book for the PCS like that, you know, so that way you can look through there and work through those things so that you can get faster. The thing about it, guys, you're going to have under 2 minutes roughly to get through all of these questions, give or take. So again, the faster you get with the book, the faster you'll be able to answer these questions. And the more comfortable you are with the book, the less you're going to get freaked out in the exam room. A lot of people will get freaked out at the last minute. They'll study, and then they'll get freaked out in the exam room because they don't know their way around the book they forgot. But if you are doing it so often, it will become like second nature, and it won't be much of an issue for you, right? So in the Optum 360 ICD-10-CM book, again, another one that I recommend, because at the beginning of each chapter, they do have examples of the codes and how they apply. So if you are getting stumped and you're getting stuck on like, well, how do we code injuries and how do I know what Z codes to use? There's an example before each chapter of this book in the Optum 360 version. So again, this is the Optum 360 ICD-10-CM book. The one that's expert for physicians is the one that I recommend. So this one happens to be the 2022. Obviously, if you're taking it now, you need the 2021. But on May 1st, you're going to need the 2022. And this is what this one's going to look like. But get to know this. There is so many helpful things. And sometimes people think that they need to memorize like the anatomy and all this stuff, when there's anatomy plates left and right in the CPT book, and there's also other things here in the ICD-10-CM book, right? And even in the ICD-10-PCS book as well. So they do have all of those anatomy plates in there. So you can take the time, guys, and get to know these books, get to studying them and looking at them. The more that you look at them, the more that you open each and every single page. And people will ask me, Bleu, I heard you say that I need to look at every single page and look at the book, but why? Am I wasting my time? No, guys, you're not wasting your time looking at the book. What you're doing is getting familiar with the book, which is very important when you are trying to get through as quickly as you possibly can. And staying disciplined and getting to the point where you know you're getting closer to your exam time. You're not going to start cramming. Guys, don't cram. The more that you cram and you say, well, I'm spending all this continuous time, 8 hours, 10 hours, 15 hours. Guys, come on. All you're going to do is burn yourself out. There are very few people who can get away with studying like that, right? So as adults, we learn differently from children. Adults have a lot more on their mind than children do. So if you're thinking that you can study like you did when you were in college, or you can study like you did when you were in high school, it is not the same. So you have to learn how to work with things. Adults, we need repetition, repetition, repetition. And when you do that, when you take little blocks of time, 1 hour, and then you take a break, and then you come back for another 30 minutes, and then you come back for another 15 minutes to round out the night. That's a lot of time that you didn't have before, that you weren't doing before, because you just maybe got overwhelmed with the amount of time that you had to spend, right? So don't go for long stretches at a time. Study for 50 minutes, 50, or 1 hour, and then take a 15-minute break, take a half an hour break, but come back to it. Do another half an hour or do another hour, okay? Whatever you want to do, but get into that discipline of studying. You have to put in the time, folks. If you don't put in the time to practice looking up these codes, if you do not take the time to practice with these workbooks, in which this is the other one that I recommend, the ICD-10-CM and ICD-10-PCS coding handbook with the answers. This is the 2019 version. but this was the one that I used when I was practicing studying and things like that, because there are things that you don't see on a daily basis when you're a clinic coder. And so it was important for me to make sure that I looked at everything all over again and get into that frame of mind. So that's what I did. I used this book. It has the answers. Don't get the one that doesn't have the answers, because it literally doesn't make sense. You need to know if you're getting the correct answers, because you need to know if you are coding it correctly. But this book is by the American Hospital Association. This book actually has a lot of straightforward explanations in it. I really like this book, and it covers a lot, guys. It's got really great scenarios in it. It's got questions and it's got the answers. So again, this is the kind of book that you want to practice in. This is the kind of book that you can write in. This one and this one, both of these, you can write in these. Stop writing in y'all's book. Stop highlighting in y'all's book. Because again, it's not going to do you any good except for be there and be all highlighted and looking in your face and stuff. And you should be concentrating on your exam and working in your exam. But guys, it's going to take you going over these books, practicing, looking up the codes in those books, reading, going to CMS, looking at all those other books that I have recommended. I leave a lot of those titles in the description box. It surprises me how many times I have to say that, because people will ask me, well, Blue, what books do you recommend? It's in the description box below. It is in the description box. So make sure that you're looking at those things. Stay out of those Facebook medical coding groups, the study prep books, because all of a sudden, when one person starts negative, it is really easy to start getting into other people's heads. And especially if you are trying to get this, you really need to concentrate on letting this be your sole focus. Focus on the exam right now. Don't focus on finding a job. Don't focus on trying to get all these other things. Concentrate on passing your exam. And I'm going to close this one out with, do not cram for this test. If you are studying right until the last minute, if you are studying right till the night before, Blue, I crammed the night before, you're setting yourself up to fail. Please don't do that, folks. Take the 2 to 3 days before your exam to stop studying, because you're not going to learn anything new. And hopefully you've been through enough of these drills and enough of this looking up the codes that you can be, okay, confident enough. Because at the end of the day, you are going to go in there with the knowledge that you have and the skills that you do have. And if you are going to try your best, then that is the best shot that you're going to have at being successful. And if you have to take it again, you have to just take it again. But again, guys, this test is very serious. And this is one of the toughest exams you will ever take. Trust me, it is hard. This is a very hard exam. I'm not going to lie. Because when I took the CCSP exam, I took it in March of last year, and 2021, and I had an hour and 10 minutes, hour and 20 minutes left still on the clock. That's how fast I got through that exam. When I took the CCS, I had 8 minutes left on the clock. That tells you how difficult this exam is. I read fast and I process things quickly. But this exam, oh yes. Oh yes. So make sure that you're looking at all these things that they have mentioned here. Make sure you're going to CMS and reviewing the website and reviewing all the materials that are there. Look on the AHIMA website if you are an AHIMA member, and check out all the reference materials that they have. Look at the standards of ethical coding. And those are available to everybody, whether you are with AHIMA or not. So you can look at those, because everybody is supposed to be adhering to those, regardless of whether you are certified with AHIMA or not. Everybody follows the AHIMA standards of ethical coding. Okay, so this is very important for us to know anyway as medical coders. But that is my advice on how to prepare. Study and practice, guys. There is no magic pill. There is nobody. There is no book that is going to get you there but you. If you need a tutor, there's a ton of tutors on LinkedIn. I'm a tutor myself. My rates are in the description box below. So if you want to set up a session, contact me in the description box. My contact information is there. So if you are out there, I wish you the best on your journey. I wish you the best on your test. Make sure that you rest before you take your exam, and make sure that you do not cram before you take your test. It is just a test. That's all it is. And you've got this. If you've put in the time, you're giving yourself the best opportunity to be able to pass. That's all I'm going to say. If you have enjoyed this, please like, and even if it was the talking to that you needed, or maybe that you didn't want to hear, guys, that's what I'm here for. All right. Like, subscribe, and share, and I'll see y'all next time. Bye.